My name is Corinne Pettit, and I will be your moderator for tonight's presentation. Before we get started, I'd like to go over a few items so that you know how to participate in today's event. So we've taken a screenshot of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. You've joined the presentation listening using your computer's speaker system by default. This means that if you can hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You'll have the opportunity to submit text questions to today's presenter by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation, and we will collect these and address as many as possible at the end. Before I introduce today's speaker, I'd like to take a moment to tell those of you who may be new to the Foundation about who we are, our mission, and what we do. So in 2014, the National Psoriasis Foundation developed a new strategic plan which drives everything we do as an organization. To achieve our mission, the following goals were identified. Number 1, accelerate discovery to cure psoriatic disease. Number 2, improve health outcomes. Number 3, achieve goals to help our mission, whether it's being involved with an event or becoming a volunteer. By attending today's program, you've already taken a step towards expanding your knowledge about psoriasis and psoriatic arthritis to help manage your disease and to find others who understand what it means to live with psoriatic disease. You can help efforts towards a cure and greater understanding of psoriatic disease by participating in the NPF and Corona National Psoriasis Patient Registry, which is the largest independent observational registry of psoriasis patients in the U.S. The registry, which involves a network of dermatology clinics, collects and studies patient health information, allowing researchers to compare the safety and efficacy of psoriasis treatments, better understand conditions that are related to psoriasis, and understand the history of the disease. You can also share your experience with researchers about what it means to live with psoriasis and psoriatic arthritis by participating in Citizen Scientist, answer questions, and view your data along with 3,600 participants. Data is used to help researchers gain a better understanding of the disease. To learn more and participate, visit the websites listed on the screen. We continue to improve health outcomes through our Patient Navigation Center, the world's first personalized support center for people impacted by psoriatic disease. The Foundation's Patient Navigation Center is available to help you find physicians, treatment information, navigating insurance issues, access support through our one-to-one program, and more. Contact us at 1-800-723-9166 or visit psoriasis.org/navigation center. To achieve the Foundation's goals as mentioned, please support our mission through donations or by participating in a local Team NPF event near you. So let's talk about what you can expect to learn today. You will get to hear about the physical benefits of staying active alongside viewing a demonstration of examples of exercises that are beneficial for those with joint disease. You also can expect to better understand the safety cautions for being active with joint disease. On behalf of the National Psoriasis Foundation, I'd like to recognize our sponsors. Presenting sponsor Novartis and our national sponsors Celgene, AbbVie, Lilly, and Mallinckrodt for their efforts as part of this collaboration to provide an opportunity to learn more about psoriatic arthritis. Without their support, this educational program would not be possible. Thank you for your support. Now I'd like to introduce tonight's speaker, Dr. Brian Blevins. Dr. Blevins is a doctor of physical therapy at Stride Strong Physical Therapy based in Portland, Oregon. He specializes in treating patients with a range of conditions such as ACL reconstruction, rotator cuff repair, and total hip and knee replacement. He also treats athletes ranging from amateur to professional in high-intensity sports such as basketball, baseball, and football. Dr. Blevins is an advanced training specialist and is certified by the National Academy of Sports Medicine as a performance enhancement specialist. Dr. Blevins uses his history of personal training, playing multiple sports, and his experience as a physical therapist to maximize patient outcomes. We're honored to have Dr. Blevins join us and to help provide tips about safe exercising to improve joint mobility. Welcome, Dr. Blevins.
Hi, everybody. Thanks for having me today. Just to start it off, I just want to proclaim, obviously, I have no financial relationships to disclose, no conflicts of interest. So when we talk about being active, of course, we want to be safe. So to be safe, we want to talk about the potential benefits to increasing activity. So The benefits of increasing activity is definitely improves flexibility, range of motion, and strengthens muscles around your joints. It definitely improves heart health. Improving cardiovascular system is vital to managing all sorts of disease processes, both for the healthy and unhealthy. It lowers blood pressure and blood sugar levels. It reduces weight and pressure on joints. That is an essential part of being physically active. Without strength in our muscles, we're just really a walking skeleton. So it improves bone and joint health. It makes it easier to sleep, and it definitely improves balance. So when it comes to changing, for many people, increasing activity is a change in lifestyle. So what we want to do is we want to build up slow, because one of the worst things we can do is if we start too fast. Very commonly we hurt more, we're more sore, which are usually negative to the system. So what we want to do is we want to start slow and work up, even if it's as little as start with 5 to 10 minutes a day, only a few days a week. And then we want to gradually increase to about 30 to 60 minutes of moderate to intense exercise 3 to 5 days a week that you can conveniently put in your daily routine. And of course, always consult a healthcare provider before you start any sort of exercise program, especially your primary care provider. To protect your joints, that's kind of what I do all day for my patients, but a couple tips here. Definitely avoid holding the same position for prolonged periods of time. Avoid performing repetitive activities. Those first two are very commonly one of the top two things that I see that cause a variety of issues, whether it be the hip, the knee, the back, the neck, anything, are those two: performing repetitive activities as well as holding that same position for a long amount of time. Avoid grasping things excessively tight. We don't want to overstress all those precious hand and finger joints, especially with those with psoriatic arthritis. Maintain proper posture and be mindful of how you move. That's kind of what I always teach my patients throughout the day. And then, like I said before, check with your doctor before beginning an exercise program. So there's many different types of exercise, but very smart exercises to start with, especially with people with psoriatic arthritis, are low impact and endurance exercise. You want to strive to exercise about 20 minutes or more a week, 3 to 5 times a week. There's plenty of different types you can do. Walking, Tai Chi is a good one. Biking, the pool is great. The benefits of the pool really help decrease the impact of gravity on our joints. And with someone with psoriatic arthritis and weak muscles, those joints tend to be very overstressed. And that's what we really want to avoid. And so the pool is actually a really effective way to not put as much demand on the joints. Types of exercises. So there's really two major subtypes of exercise. There's the range of motion exercises and then strengthening exercises. So range of motion exercises are without resistance, usually help maintain and improve mobility of the joints. And simple guidelines are safe to say frequency, you want to be about 2 to 3 sets, and the intensity is about 8 to 10. I would maybe even up that to 8 to 12 repetitions a day. And of course, duration is daily. With the range of motion exercises, you also want to move through the joint through its normal range of motion, which is it's just pretty much your pain-free range of motion. If you are limited in terms of range of motion, you want to take those joints through relatively pain-free range as to not further exacerbate any sort of condition. And then if you're stretching to increase range of motion, you want to hold that for about 25 to 30 seconds. You can go as far upwards of 2 minutes. The research has shown that stretches of anywhere from 30 seconds to 2 minutes are extremely beneficial at increasing range of motion and flexibility. And you want to do that anywhere from 2 to 3 times. Strengthening exercises. So to help ensure the joints have as much stability and strength as possible. You can do very similar frequency, intensity, and duration, but of course, usually strengthening exercises actually involve resistance. So 2 to 3 sets of 8 to 12 repetitions, and that can be anywhere from 2 to 3 times a week. And you definitely want to split those up, so allow a rest day in between. Usually, you absolutely want to create perform and slow controlled movements. You don't want to, especially early on in exercise programs, you do not want to create high velocity movements. Those tend to create more damage than they'll give you benefits. So you can hold for 3 to 5 seconds in protected ranges of motion, and to start, use light weights with more repetitions. And of course, early on, avoid the use of really heavy weight. Okay, so the safety guidelines, very, very important. Moving very slowly and gently throughout the motions, no jerking, no jerky movements, and that kind of goes back to what I was just saying about high velocity movements. We don't want any of those. It's actually pretty dangerous. You want to pace exercise to avoid fatigue. And by fatigue, we mean no excessive fatigue, where you can barely lift your arm or your leg or whatever joint you're working. We want to fatigue the muscles, but not the whole system. Stretch only to the point where you feel tension. So with psoriatic arthritis, you do not want to overstretch the joints, because we may be getting into the point where we're engaging the tendons of the muscles and the ligaments, where there is an active inflammatory process going on, and we can actually create damage to the tendons, which we do not want to do. Of course, if pain becomes worse, stop. And then, of course, don't forget to breathe. Oxygen's a very, very important component to exercise, and our body likes it. Of course, listen for any cautions. Of course, fall prevention is essential. Use protective devices if needed, such as a splint or brace, or if you're normally ambulatory on a walker, then do your exercises. If you want to do standing exercises, make sure you always have those devices close so you can stay stable. All right, so here are the exercises. These are adapted from the VH1PC kit. The hand range motion, finger flexion and extension. This is just pretty much basically actively bend the fingers of your hand. Start with the knuckles furthest from the palm and slowly make a fist. Hold 2 seconds, relax, then straighten fingers as far as possible. To help define the right treatment plan. Oh, there we go. And so back to the finger flexion extension exercises. You can repeat these 10 times per set. Do about 2 to 3 sets per session, and 1 to 2 times a day. And safety guidelines, of course, if you feel pain, stop. Remember to breathe. Move slowly and purposefully.
All right, now we're going to access the videos. Just a moment here. We're actually going to have Brian see a video of Brian demonstrating these moves for you, so you can do them at home alongside. Just one moment.
I actually thought it was pretty good progression for this. It's, you know, some people have a stress ball, so a squishy stress ball, you can actually have a little bit more resistance to it without any sort of stress, right? But we just don't want to have that big impulse or big squeeze. You can add maybe, if you have some Play-Doh, there's some Theraputty that you can obtain. They're pretty easy to obtain. Amazon has everything. But, you know, you can kind of squeeze in there, work with your hands, make it a ball. You know, that's really functional in terms of restoring strength and mobility. So, okay. Next exercise is finger opposition. So what you do is you kind of the hands open to start, and then you start with the index finger and proceed towards the little finger. So you can kind of work your way through each finger. It's actually kind of what makes us human. Finger opposition, right? What distinguishes us from primates is our thumb. So come back through. You can decide if you want to hold, if you want. Hold it a couple seconds.
Should you be bending your fingers or keeping them straight?
So either way. So again, if you're restricted in joints, you do it with kind of the path of least resistance. And, you know, the natural version is just kind of the circle, right? And we even, in terms of testing for strength of opposition, we tend to actually make it form these lines. Don't let me pull my finger out. Right?
Yeah, because some of my fingers want to go straight and some
of
them bend.
Yeah, and that could be the way, you know, the backside, the tendons on the backside and the end of the day. It could be the joint structure. You know, since there's degradation in certain joints and they're restricted, then you just kind of do it how you do it, right? Sometimes we're not going to completely restore full health of joints, but we can maximize the function well. That is that they're in. Any questions on that? No, good. Very good. Okay. Next exercise. Okay, looks like we are standing. Okay, so let's stand. Okay, this one, shoulder abduction. Okay, that's kind of the anatomical term for just to your side, straight to your side. Okay, so I think there's going to be possibly a lot of restrictions here. So we want to go through the full range of motion. So what we do is we come up just to your side, come up, and right about kind of 90 degrees, you want to kind of open your palms. That's going to help kind of clear some room in the shoulder, and you kind of notice it feels a little more natural. You kind of come up all the way. Anybody have any pain? Sit back there. Yeah. Yeah. So what he's shown looks like there's a little capsular restriction. So what we can do is angle in it. You know, we can look orthopedically at the whole system. You know, can be shown this. Okay. So if we're having trouble coming into we call pure abduction. Okay. So is there a little pain there? Yeah. So he has some capsular restriction, probably a little bit of restriction in the pecs. Okay. So what we can do, if it's a little more comfortable for him, he can come into what we call scaption. Actually the angle of the scapula, okay, and we just come up at about 30 to 45 degrees out from the front. You can get a little more range of motion, less pain, right? So now he can kind of work into that way. So try and go two arms, just in that, kind of that 45 degree position. Now he has a little more room there, a little less pain, right? Yeah. And as he goes, as he practices this over the next couple weeks, he can kind of start working his way out, because more than likely, as he's stretching, it's going to work its way out through practice. Body may respond and maybe a little more freedom of motion. Does that make sense? Good. And that's just a pure range of motion one, and you can do that in really all planes. You can go flexion if you want to, right in front, same thing. Probably going to have, if you have kind of restriction in flexion, I'll probably see one in. If you have one in abduction, you'll probably have a restriction in flexion. So that scaption, the body loves that scaption. You had a little pain there, yeah. Yeah. So then you just kind of go in the, especially if you're an active inflammatory, kind of a flare up, then downward, we just don't do that. The bicep tendon is pretty fragile there, so is the rotator cuff tendon and the capsule itself. So this one, external and internal rotation. Standing. This is actually kind of, not necessarily advanced, but if you have some sort of restrictions in the shoulder, you're definitely going to see it on this. So we're going to hold it about 90 degrees. And we go about 2 sets of 10 on pretty much all of these exercises. But one thing we want to do is we want to keep the shoulder blades down. Okay. Now, what you'll see a lot of people, when you drop the shoulder blades, the arms drop down. You see that? So that's actually restrictions in the shoulder, right? So what we want to do is we want to pinch the shoulder blades together, okay? And you want to bring them down, okay? Now, with that, we want to try and keep the elbows as high as you feel comfortable. And I don't want to have them go above 90 degrees, okay? And then we go back. Here, all the way to here, and all the way down as far as you can. You're not going to probably have a lot of limitations, or you probably have a good amount of limitations going into internal rotation, because up in this position is kind of restricted form, but you just kind of go back and forth. And again, if you have restrictions, we just come down, same thing. Just work, range of motion. It's all about the rotation. So for you, I'd have you drop them back here. So, and if you have problems getting in the position, right, getting your shoulder blades in the correct position when you're up, start over, drop the shoulder blades, get in a good kind of soldier position, then focus on where your shoulder blades are. If you kind of go here, see, that was much better. Right, you may feel that correction there. Drop that down. Now bring the hands back. You have some anterior chest wall tightness, a little bit anterior shoulder. Yeah. Good. Any questions?
I've been doing my yoga.
No. Haven't been going to PT. That's right. Okay, next exercise. Okay, so we can add some resistance here. So this is a good exercise, and you can do it in a lot of different ranges of motion. This is, we call it resisted horizontal abduction. So horizontal, right? And abduction just means we're going away from midline. Okay? So this is midline. Okay? So what you can do is just kind of wrap it around a couple times around the hand. Okay? Some people like it like that. However it's comfortable. Yeah, I have some people kind of wrap it around and we go above. Wherever's comfortable for you. Yeah, you can. So we can just, you can kind of hold it like that where the thumb's restricting it. The thing about bands is when we're here, first a little bit of range of motion is really easy. Okay? But when we start coming out, it gets hard quick. Just the elasticity, kind of how the elasticity of the band works itself. So the closer you are to start, the much harder it's going to be when we open up. Okay? So what this is doing is going to strengthen actually the posterior shoulder. Kind of, there's a whole lot of muscles back here. We got your kind of your posterior rotator cuff, back of the shoulder. You got the kind of the intrascapular muscles here, which is part of the traps, the rhomboids. Their goal is to retract the shoulder. Okay, so this is we live here, right? Our entire life is here. So the body loves this. Okay, so when we want to wrap this up. Okay, nice straight. Now remember what I taught you with the shoulder blades, right? We're not up, we're down. Straight out. Now, preferably, we're leading with the back of the palm. That's a lot of what we call external rotation, okay? So if you have some sort of limitation there, you can go palm down. A little more comfortable that way. Okay? You feel like you're not doing it right?
Yeah, I feel like
I can feel on tape. It's okay. Try it again.
it's just like it feels unstable. I guess.
Yeah. And so
Like it's like when you said just to do a palm down, it felt worse than like much more unstable.
And that has to do a little bit with the way the capsule behaves in terms of motion. And the capsule is just capsule is kind of, imagine if the capsule is kind of almost this thick.
Right.
You wrap it around the joint, the shoulder through shoulder joint, it tightens up. So this may be a little more comfortable for people with that
right.
Backwards.
Like it doesn't feel as shaky.
Yep.
to keep my arms straight.
Yep.
With it.
And so what we want to do is set this first, and those shoulder blades together. Now bring those arms up, the hands up to the horizontal, and come out to the side. Focusing on the pinch in between the shoulder blades. Yep. Shoulder blade pinch. Yeah. Where? Right shoulder? Yeah. Pretty good though. And you can kind of avoid a lot of times we'll try to overproduce the motion with certain joints, right? Because of the advantage. So if you focus here, maybe not do so much motion with the shoulder. Really important muscles without having to take this joint, which is where we're having the problem with psoriatic arthritis, through that range of motion. Make sense? And that's kind of what we do in terms of compensations anyways. Bad compensations, which gets us into trouble. But there are some compensations we can do where we're just emphasizing, that's all we're doing. Right. So if you have limitations in the shoulder joint where you're just getting back there is uncomfortable, let the shoulder blade do it. Shoulder blades are extremely valuable anatomical feature. So that's there's ways to progress. Yeah, great question. There's ways to progress. So when you add a hold to it, you'll notice that may actually increase the rate of perceived exertion, right? So if we're going out here and maybe early on we're not as strong, so nice smooth motion with no pause, okay? Or you want to maybe start to get a little stronger, get out there, hold 1,000, 2 1,000, 3 1,000. You'll notice holds aren't always necessary as long as you control tempo. If you control the tempo of the exercise, you make the muscle work harder. Both the way it works neurologically and physiologically.
So rep-wise, what do you do?
2 sets of 10, 3 sets of 10. Yeah. And early on you want to start low, especially those with more fragile systems. You want to start low volume. And that's really how we progress is, okay, well, maybe we don't change anything. Let's just change the volume. Right? Let's not change the exercise. Let's not change the form. Let's just change how much we do it. Okay? Easy enough? Okay. Next one, PNF. We call this proprioceptive neuromuscular facilitation. Okay? Yeah. So what do we do, right? So it's essentially just a pattern, a really natural pattern of movement the body goes through. So it looks like we have this one starting actually, imagine you're drawing a sword. So you can kind of hold this with one arm, okay? You're kind of drawing a sword, and you can kind of wrap it around. I don't know how they have it wrapped here, maybe like a little bit like that. So imagine there's a sword here, okay? And you're coming out. Opening up that way. Okay. So you're kind of leading the whole motion with the thumb. So if I have a sword here, right? I'm drawing the sword, coming out, showing it to everybody. Makes sense. So this is a really advanced exercise, and it takes a lot of awareness what you're doing, right? Where your shoulder blade is, right? Where your limitations are. Where your shoulder itself is, what your hand's doing. Are we going through a different plane of motion here? Are we because of our compensation, right? I'm going to have you do that again. So if it's too hard with the band, go on down. If it's too hard with the band, just take some tension off it. Just a little. Yeah, just a little bit. So now we set here, okay? Always set the shoulder blades. Okay? Now draw the sword. So the sword starts down there. Now, as you come up, now start rotating. There. There. Yeah. Now we drop this a little. Now bring your hand up. A little tougher, right? Yeah. And you should feel kind of the nice crossing pattern here that you feel. Right. And then, of course, with the right shoulder, you're going to have a hard time doing that external rotation. Oh, right. Feel that? Yeah. Yeah. Right. So you're drawing here, and you're drawing the sword, you're coming up. Natural is a really kind of a diagonal PNF pattern. complex movement. But all of these movements are actually seen kind of building up to that. Right? It's kind of the, so all the exercises before are involved in this last exercise. And 2 sets of 10 is good for that right now. There's no set time when you want to start the rotation up. So some people are a little stronger. I usually kind of get it going already as I'm coming up, right? So don't wait till you're here to, right? Because it's all this smooth, all in one. It's a smooth motion.
It's like a gradual.
Yeah, exactly. Yeah, just it's kind of teaching the body to really make all these muscles work in unison again. We do this a lot for post-op rotator cuff repairs. Even people with really a lot of instability, so dislocations, things like that. So this movement is just facilitating natural movement patterns, and it's actually kind of helping the brain fire those sequences more effectively. Okay. Okay, we're on to the legs. Okay, so we can sit down. Knee extension. This is a really, really commonly done exercise. In my opinion, it's done improperly 95% of the time, even in the gym. Okay, actually, orthopedically, it can be a very bad exercise if you don't do it correctly. So. Going back to what we talked about at the beginning, maximize muscle activity while minimizing joint reaction force. Okay? Say that again. Maximizing muscle activity, minimizing joint reaction force. Okay? So when we do this exercise normally, and a lot of people can kind of see where their limitations are if they're having pain if you just do a body weight first. Where you're just starting up, obviously nice good posture. Keep your core always drawn in, especially when you're doing leg stuff. Come out, straighten that leg, come down. And people who are extremely deconditioned, they can add a little rest period in between. As you come up, hold it for about a second or two, get that nice squeeze here in the quad, and come on down. Okay. Anybody get any clicking in your knee? Yeah. Okay. And then make this, you want to make sure that this one isn't too jerky or too rapid. Right? We don't want any quick power movements because we don't really, I'm not trying to kick it. We just want to, that's that in. What is it? Quad. Yeah, hamstrings on the back side. Yep. So with this exercise, why I said this exercise can be exacerbating is if you don't pay attention to the range of motion. Okay? We consider this it's called an open kinetic chain exercise. Okay? Open kinetic chain just means the farthest point of my body is not touching the ground. Basic explanation. Okay? So when we look at force, joint reaction force in the knee, very commonly the most painful thing in the knee is the kneecap, actually, where the kneecap is gliding along the femur. Okay? So someone with psoriatic arthritis, maybe is an active inflammation. If we go past a certain range of motion, which I'll tell you in a second, if we go past that certain range of motion, this can really flare them up. Okay? So that range of motion in an open kinetic chain is 90 degrees, the safe range, is 90 degrees to about 50. That's not a huge range of motion, right? So what you want to do is you can even kind of anchor yourself down. What I teach people is you can kind of, in your chair, you can kind of, just a comfortable pull. Again, we got to, be cautious of any sort of finger, wrist, elbow, shoulder issues. But you can kind of just give yourself a little pressure into the seat. You feel kind of your sit bones kind of pushing the chair. Now you just kind of just lift the leg just a little. Kick out here. Hold it. But remember, pay attention to that range. We'll go a little lower. Just the foot, not the thigh. A little lower. We want this up, and that was to there. So we're talking this angle right here. Oh, okay. So we want that to about,
that's a lot easier.
But what you'll do is, once we start getting some resistance on this, actually, this thing you'll actually get a higher rate of perceived exertion here than if you're just doing this, right? Because what happens is as we come up, right about this point. And you can feel, put your hand on the top of your knee. At a certain range of motion, you're going to feel like a little poke. Right? And that's actually where the compressive force jumps up. And so now you add resistance to that. Now we start getting multiples of whatever force you're thrown at on your knee, which can actually create activation. You're feeling where maybe anatomically that kneecap or your femur's starting to kind of shift and change its position. So what we do now, like this, has just on your shins, okay? You kind of roll that up over your shoe, okay? And your quad is really, really strong, okay? So you probably have to put a good amount of tension on here. And so some people, tie it. You can maybe even, if you're in a chair without something sharp that'll cut the band, you can kind of put some tension on it, put the chair on it, or step on it with your other foot. Yeah, that's a good example right there. Yeah, there you go. So with a chair like this, that's really effective. Yeah, because we want the force always coming from under here, right? And that's really what machines are good at doing, and make the muscle work to the full range. So now, add some good tension to that. Okay, you guys got it back there? So add some good tension to that. Raise that thigh just a little. No, I don't want any hip pain or anything like that. And then now, give me 10 of those. Maintaining that nice, getting that thigh up a little bit, and that safe range of motion. Keep going on the quad.
Yeah, and I'm feeling it in my
Yep. So, where are you going?
Here.
Okay, let's see it. So, I'm going to add the resistance there. You sit up tall, okay? Now, remember, don't forget to pull up on the, I know one hand holding the band, but add a little bit of pressure to the seat, right? Let's go this leg, okay? Lift the thigh just a little bit, right there. Hold that up. So we just kind of maintain, maybe just be able to get your hands under that and kick out stuff right there. Maintain that thigh position. Where are you going now? Yeah. So what we've done, we just maximize how the body works. And she does 2 sets of 10 of these. Let's go full 10. There you go. Maintain that up. Down my hands. There you go. Keep going. 4. Thigh up my hand. There. 5.
yeah, anything after 6.
Yeah.
Myself so much.
Yeah. So quad means 4, right? Quad means 4 quadriceps, right? The 4th quad muscle, that's it right there. So if you had to rate how difficult that was, your 10, what would it be? 10 is the hardest.
7.
That's where we wanted. 7 is a great RPE. anywhere 6 to 8. Once we start getting a 9, 10, right? Especially with someone that if you're actively irritated, if you're in an inflammatory stage of the disease, and we don't want that 9, 10, right? And then it's just moderation, and of course we want pain-free, right? We want all the. I don't like pain. Right? I don't ever consider that pain, right?
It doesn't hurt, yeah, and it doesn't hurt when I stop. It's just definitely an effort.
Yeah. And so what I was going to say is that the quad is 4 muscles. Okay. 3 of them just cross the knee, the 4th crosses the hip. So if we're just straightening the knee, yeah, the 4th muscle is working, but are we working it as hard as we should? Or we can't, right? So I'm minimizing this range of motion, but yet adding a little bit of what we call hip flexion, getting that thigh up, we'll actually get a much larger electrical signal actually to the quad from the brain, because it's making it work harder.
Everybody to hold it up and hold it steady.
Yeah. This is a really comfortable exercise with all my patients, all of them. The only time it's not is if they start violating that range of motion. If they start getting up in that higher range of motion afterwards, and a lot of people especially with any type of arthritis, if it's psoriatic and it's obviously in the inflammatory stage, then yeah, probably it's going to hurt. You'll know it, but some people it'll be retroactive. If you do it wrong, you may not even notice that you're doing it wrong at the time. 2 days later, you're like, man, my knee hurts. And I get patients a lot where oh, you know, that kind of hurt after I did it at home. Well, was it the exercise or was it the way you're doing it? Right? So it's not about, and that's how I teach my patients. It's not about, it is about what you're doing a lot, but it's about how you're doing it. That's the main question, right? That's the main answer when it comes to exercise prescription. So, got it? Got it. Okay. Knee flexion. So, nope, keep going. Knee flexion is just, so that was knee extension, okay? With a little twist on it. But knee flexion is just actual now the hamstrings. Okay. So this one, okay, I see what they're doing here. So this one can be a little tougher to kind of wrangle. So with this one, what they're doing is this one's out. Okay. And you may have to, looks like it's tied on both ways. Yeah. So you may have to make another little knot. Okay. We don't have to do it here, but you can just maybe even wrap it around here a couple times. Right. So what this one is, this one's up. And maybe up on a box, if we had another chair. Turn this upside down here. So what they have us doing here is, this is the anchor, okay? And that's the anchor. You hold this up. You hold that up, and now you're pulling back with your left. Okay? Doing there, just adding a little resistance. A little more kind of awkward to set up, but if you
if you had a chair,
yeah, get a chair, or you can even, you know, a lot of patients will love the door handle, right? Take it out, strap it on the other side of the door, close the door. You know, that may be a little high, but you know, figure out something to strap onto, or you know, even if you had partner, significant other, training partner, whatever, you hold on to it, I pull, or I'm pulling back, then we switch.
So you don't need it.
You don't have to have, right, you know, but it's a little easier because with your
tension.
Yeah, it's just the tension what you're trying to get. Okay. Same thing, 2 sets of 10. Hamstrings is in terms of that motion. I know it's very similar. It's a very similar motion to the knee, but there's no really strict range of motion guidelines you have to make. So full knee extension is okay, because this isn't on, right? This muscle's not on, right? So we're working the hamstrings, which is the back of the thigh, and those we're pulling back. Good? Any questions? Good. Okay. Hip abduction. So this one's standing. This one is standing. Now, this one I think is also done, taught, and performed, not amazingly efficient. Because what this is showing, and it's just showing the lower body in the picture, but what you'll see is if you just did it freestanding, when I have 2 legs, right? But if I take one off the ground, I have to shift over. Okay, what I'm going to do is going to change the way the pelvis behaves. Okay, and I'm over here. So this is the exercise. This is standing abduction. Okay. What we want to do is as we come out, we want to make sure that our toe doesn't pop out. Okay. We're not rolling out like that. Okay. We're right here. Now, if we have balance issues, this could be a big deal, right? So hold your chair. Okay. Hold a counter. Counter is great because you're up at waist level. You're holding. And what's actually really beneficial, when I teach this exercise, I actually have people hold on, and so we can control body weight shift. Okay? So you use the wall, or actually, yeah, you use the wall as kind of you're almost leaning away. So like this, what I tell my patients is hold the inside of the sink on the kitchen counter. So you're not leaning on it, you're actually pulling yourself away. So that is actually your balance point, right? So now what's going to happen is you're going to work both sides. Okay, because this is the muscle it's going for. Okay, it's working the hip joint itself, but we're working the muscle so as we come out. Okay. So if I have hard to do, right, without holding on to something. But if the chair is lying at the dining room table, anything, right? But
We should have better balance, all of us.
Yeah.
I'm going without hanging out.
and I always say always hold on, right? So exactly. So and it's not a crazy range of motion. You're not really trying to get up here. We don't want to see any crazy trunk lean, right? It's just very strict range of motion, only about, what would you say, probably 45 degrees I'm at here, right? Anybody have pain on this? Tight? Oh, yeah, yeah. So what you'll see in tightness, go ahead. You'll see that foot turn out. Okay. So then we just want to make sure that stays straight. Okay. And again, posture here, right? What's the number one thing we want to protect in the whole body? Skull and spine. Skull and spine. Okay. So we want to go here. And then what you'll see if a little bit of increased weakness, you'll see it drift out. Right? We want to stay straight. Almost maybe go try and in your brain kind of try and send that heel behind you a little bit. Where do you feel that? And kind of there, right? So now come do the same thing, but bring your heel back towards me. Where do you feel that? Give me 10 of those. Kind of right, nice pulley right there. And you may, if you're kind of over squeezing, you may get a little spine involvement where you're kind of doing that extension compensation. Okay. But you can see how without holding on, this can be actually kind of a tough exercise, right? So the chair would be good. You definitely don't want to have it at a counter, right? Or anything, you can just kind of give yourself a little bit of stability, right? And then once you get stability everywhere else, you're not having to fight the balance strategy and just get through the exercise, right?
Right.
Okay, I'm done, I'm over it. Yeah. No, we want to, and you'll notice once you get in that nice position, here, you hold on to me, okay? We'll do this, okay? You lean away from me a little bit, there, now do the exercise. Give me a full set of 10. And then don't rest at the bottom. Go right back up. Don't turn the toe out. You feel the left hip a little bit? Yeah. Right? So that's a good, and I may be getting a little more advanced here than everyone wants to know, but this muscle, yes, it does this, but it actually controls the pelvis. So never really is it just going one works, the other one works. It's always working together. Yeah. Right? They're always working both together. So when you stabilize your balance, now this one is doing this, right? But what is this one doing? Controlling the pelvis.
I think the stronger you get doing this, would it improve your balance?
Absolutely. Yeah. Absolutely. There's 3 balance strategies. Okay. There's if I came in and I just pushed you, lightly, ankle strategy. Okay. Next one, push you a little harder, hip strategy. Okay. Next one's the third one. Yeah. Where do we all rely on? Third one. Right. We step. Yeah. Right. That exercise, great at the first 2. Because we're stabilizing, we're working this one, we're working this one, but look at all. Ankle. It's a great exercise, especially standing. There's, I've taught a lot of people to do this just laying on your side, right? But I don't think it maximizes the way the body behaves naturally. So people, that is a regression. So if, maybe just standing is not right for some people. Maybe just the force of their own body weight. If you're doing this exercise, the standing hip hurts, the standing knee hurts, just do it on the side. Just lay on your side, same thing. And just going up on the side. Really basic stuff. Good. Any questions? Okay, this is good. Okay, functional quadriceps, the chair squat. My jam right here. Okay? So squats. This is what we call a closed kinetic chain exercise. Okay? So this is open chain, correct? This is a closed kinetic chain. So again, maximize the muscle, minimize the joint reaction force. Okay? So the mechanics are actually a little bit opposite. Okay, so we want
it's pretty much the joint that's going to receive the majority of this force. Okay. That's what a lot of times we rely on, especially if we're weak in certain places, right? Because what we'll see is when people sit down, they hands on the hips, right? Maybe just you're here, and then you just kind of sit back into the chair. Okay. If you look at the knee, the joint reaction forces are pretty comfortable from about 0 degrees, which is straight, to about 50 or 60. Okay, which this picture does a pretty good job at. Okay, so right there, go hold that squat. Where do you feel that? Knee. Okay, can you see where his weight is from there? Like just imagine
they're all of them
in the front.
Yeah.
Correct. So if you were to sit in a chair like that, what would you do? You would hit the chair, right? You would fall forward. So what I have him do is pretend that my knee's a chair back here. So you bring your weight back a little bit, keep that head up, right? That's the head's like a 15-pound bowling ball. Don't always fall off your shoulders. So we're here. Hold on to that. Keep your quads a little held. Okay, come up just a little higher. And then right there. Now chest up here a little bit. Okay, where do you feel that? Right? So you can add repetitions to this, so that's good. Yeah. And now we're working body weight. So the leg extension was just a band, right? Now we're throwing however much you weigh through your quad. Yeah. Right? So you go ahead.
More than that band.
Yeah, this is actually what I do is I bring you back a little bit, right there. You can really feel that. Hold it. So my patients, even the most deep conditioned ones, I give them this. This is actually one of the very first exercises I'll ever do with my patients. Back pain, knee pain, hip pain, ankle pain. I don't care. I'm going to teach you how to absorb gravity. Where do you feel that? Yeah. Calves are probably tight a little bit, right? Back of them, yeah. So because you're going here. Think about. Don't pay attention. Don't be so obsessed with the knees. Pay attention where this is your center of gravity, right? Send it backwards forward. Yeah. There you go. And that's fine. Different people are going to respond differently to a little bit of range of motion. If you're really, really weak, 30 degrees. This is simple. Don't go too low. Remember, after a certain range of motion, these are going to hurt. Right? And you can add a 2-second hold if you're just too weak. Just go up and down. Yeah. And it's not
then you think of.
And I never cue people to do that exactly, right? I never cue people to just be like, think about it afterwards, what do they do? Right? Then they focus on this. Yeah. Because what the body does is there's always this kind of handshake in the range of motion between the knees and the hips, right? So as I come down, because these muscles, what they're doing is they're preventing knee bend, right? Because I didn't have these, and I went to bend my knees, I'm falling straight to the ground. So I'm resisting gravity. So I have all my patients do this one. This is a great quad exercise. Like I said, you can change up the range of motion, right? You can change up tempo. You can change up how long you hold it. Now I think, most of my patients, I'll have them 2 sets of 10 to 15, about a 3 to 5 set hold. Right to start. Yes. And I'm usually I'm on top of them, right? I'm really paying attention for them because this exercise is pretty advanced in terms of where you need to be. We were all over the board, right? Right? Majority of us were here, but then when I tell people to correct this, because what you're actually doing is you're protecting this. You're protecting the spine. So when I say get your butt back, we do this. And then what happens? The back hurts. Right? Because you're keep that straight. Yeah. And you can keep the spine straight well. Right? That's like perfect squat is and this picture does a really good job. Is the tibia, kind of that lower leg there, is parallel with your torso. Right. So if you have knee pain during this, there'll be a lot of people, especially with an inflammatory psoriatic arthritis, that they wouldn't like this right away, especially if you're in an inflammatory phase. So where do we go? Sure. Let's work up. Let's work up to gravity. Right? Sometimes your body weight is just too much.
So the thing is, if you can do this, let's stick that.
Not necessarily, because it is an open chain versus a closed chain.
That's right.
And so if you kind of, I have some colleagues say, okay, well, how do you work the muscle in the joint in the full range of motion? Okay, that's a great question, right? So because we're only going 0 to about 50 or 60 degrees here, right? What's the other exercise? 90. We're going through 90 degrees right now. You're right. Right. And then the hamstring one, where you're pulling back, the knee flexion exercise, you can take that the whole way. Right. So those 3 exercises are going to work not only strength but also keep that knee mobility and range of motion up, all while minimizing joint reaction force. That's what we want to do. I do all day. Right. In every joint, spine, hip, elbow, shoulder, body. Okay. Maximize joint position. Joint reaction force.
So you got somebody that does eat religiously. How often then do you need to see them in your office?
So if I were to see, let's say, first visit, I'd say 2 times a week for 4 to 6 weeks. People shouldn't expect these gains to occur immediately. The way the brain works, neuromuscular activation, that first, oh my gosh, I'm stronger, doesn't happen for 3 to 6 weeks. Most people, it's around that 1 month mark. And what you'll see is a dramatic increase in strength. It's an exponential increase in strength.
You really do have to do that low.
Yeah. So as you come up, and then you kind of a smoother ascent. So in the first 3 weeks, if we're doing that squat, you're like, oh man, I can do like 10 seconds. But then later on, it's, oh, I can't do 15, but let's go to 11 seconds. It's a slow, gradual.
Sure.
And then again, if you start talking to people about like with pathological disease like psoriatic arthritis, let's progress slower because we don't want to jump. We don't want to just hit pedal to the metal and oh my gosh, I feel good, and then we get a flare up, and it's way worse because we've been degrading the joint too much, right? Whether it's improper form or too fast progression, or you name it. Yeah. Any questions? Yeah, one more. Really basic one, we should be doing 10,000 times a day. We're taking 10,000 steps, right? Going up on your toes. Okay? Balance, big thing, right? So I would suggest most people hold on. If you have a chair or even a wall or something, right?
But again, once you do this for a while, you can do it without holding.
The way the physics of the ankle works, this is actually one of the most efficient joints and muscles in the body, but still is a very valuable exercise and it's underlooked. I would go with and it's really, number one thing, don't just drop it. One of the most effective phases of exercise is when the muscle's loaded, but it's light. So in this exercise, it's when I'm coming down. So this is, my muscle shortens here, and I'm lengthening it, and I'm under a load. You'll notice I'm not much stronger. And progression to this, you do it on a stair, right? Where you can maybe drop your heels a little bit below.
It's an exercise we did for plantar fasciitis.
Yep. We do, yeah. We do. I do progress that for people with plantar fasciitis. Yep. Yes. I love pool exercises for. Yep. If you have pool access, those squats would be awesome. Because decreased gravity, right? You can improve buoyancy, decrease peripheral resistance, right? So the blood flow is a lot more effective, less taxing on the heart.
Pool therapy. Hanging on the side of the pool.
Yeah. It'll be much easier, right? For if you're working here and you're like, okay, but maybe if you're weaker, you can progress to more of the shallow end, right? So more of your body's out. A lot of ways to do it. The knee extension exercise, awesome to do in pool. no weight, you just dangle your legs in the pool. Out there, you'll feel that resistance. There's even like adaptive equipment you can put on your feet. They're kind of like pins, like super pins, kind of like that. That'll add a lot of resistance. That'll work that squat big time. Yep. A lot of ways to change up exercise. A lot of ways. But always remember tempo, pain-free, right? And no jerky movement.
All right, great. So now we're going to go back and move into our question and answer time.
Okay, hello everyone, and thank you for joining us for the Step Therapy Patient Protections in Texas webinar. My name is Amy Prentice, and I am the State Government Relations Manager for the National Psoriasis Foundation. For those of you that aren't,
Sorry about that. I have a little technical difficulty there. We're putting up the slides here again. Just one moment. All right, so I will turn it to you, Brian, for these last couple of slides, and then we have some questions for you.
Excellent. I hope you guys enjoyed the video, and I hope it helped you out a little bit for your future activity. But to help find the right treatment plan, of course, I think you should absolutely consult a physical therapist, whoever you have access to. But physical therapy and rehabilitation, a potential physical therapy plan for psoriatic arthritis could include a whole bunch of things: general aerobic conditioning, proper positioning of joints, coping strategies, so like job accommodations, bracing, splinting, assistive devices like walkers, canes, crutches, things like that. But of course, a physical therapist can do so many more things. Manual therapy, things that can help you while you're having a flare-up that aren't necessarily exercise-based, but can improve activity and range of motion and things like that. And so these are all the resources to help you. The webcasts, learn more about the research, treatment information, and living well from key thought leaders in psoriasis and psoriatic arthritis. You guys can request a free pain management guide and tracker booklet and learn about types of pain, pain management and prevention, talking with others about your chronic pain, treatment options for chronic pain. And these are further resources to help you. The APTA, you can, a lot of, especially if they're members of the APTA, a lot of PTs around the country are registered, and so the APTA will actually have their practice locations, contact information, things like that you can talk to.
All right, perfect. Well, thanks so much for sharing your insights with us and demonstrating those exercises. So we'll go on to our first question. Is a stationary bike good for psoriatic arthritis?
A stationary bike, yes. I think biking is great. I think biking kind of lives in a low-impact genre of exercise. If someone can't handle walking or running or any hiking, stuff like that, biking is a great way to strengthen the muscles, especially the quads, hamstrings, and glutes. As well as take the knee and the hip through certain ranges of motion without the impact that gravity normally offers. And with a lot of exercise bikes, you can change resistance from all the way from 0 all the way up to like you're climbing a hill. So yes, exercise bikes are great.
Great, thank you. Next question here. In the long term, trying to stay active either with golf, swimming, or hiking, are you accelerating the damage or not?
That's a good question. That is a really, really hard question to answer in terms of generalities. So what I would say, I get questions like that all the time from all people with all different diagnoses. So when it comes to that question, it's really, hey, does the activity I like doing hurt my joints or aggravate, further exacerbation? The short answer is I think all activity is good, but I think you should absolutely consult a physical therapist to have them go through their evaluation to test range of motion, strength, pain, sensation changes, all the impairments that can lead into aggravating activities. The activity itself isn't going to bother you, but the impairments that you have, which impairments are strength, range of motion, things like that, those impairments can aggravate it. So I hope that answered the question.
Perfect, yeah. And this next question here was in regards, I believe, to the knee extension exercise. They say, I've been diagnosed with severe arthritis in both knees along with PA. When I do this exercise, even without the band, I feel a lot of pain and there's a lot of clicking. Do you recommend continuing with this exercise?
So I don't think I would. There are plenty of ways to turn the quad on. You can try to work through the pain-free ranges. If there are none, I think you would be a perfect candidate. The person that asked this question, I think you'd be a perfect candidate to go see a physical therapist, as long as they're educated on, which they should be, on proper joint mechanics, biomechanics, how to load the muscle safely for you without stressing the joint.
Perfect. Next question here. I've been a runner my whole life. A few years ago, my Achilles tendon was inflamed because of psoriatic arthritis. Now I'm okay. Is it fine to start running again?
Oh, I have that guy. I work in a running clinic actually, so I get that question quite a lot. Well, I think again, I think you should consult with a physical therapist because there's a reason why, other than the psoriatic arthritis, which is a huge factor that plays in the role of aggravation of tendons and joints. There probably is some impairments that are present. I bet the calves are probably really tight, as well as the ankle joints could be limited. There's a reason why the Achilles was stressed the way it was. So I think there's some certain exercises that a physical therapist can recommend for you, or that you can perform at home, like those calf raises that I was showing on the video, that address probably the present impairments that are there, so you can get back to running. Because I think if you just jump back into running, you are at risk probably for possibly re-aggravating the Achilles. I think someone should look at it and make sure that it is safe, and then they can clear you to go back to running.
Great, thanks. Next question here. If a person has enthesitis with no damage to joint capsules, what kind of exercise doesn't involve tendons?
Sorry, I didn't catch the very first part of that.
Oh, if a person has enthesitis with no damage to joint capsules, what kind of exercise doesn't involve tendons?
Oh, there aren't really many exercises that don't involve tendons. I mean, you could any muscle activity really involves tendons, right? Tendons are things that go directly from muscle to bone. So if your body is producing movement, usually a muscle and a tendon is involved. No joint capsule damage is obviously, of course, a good thing. The only other things to maintain range of motion would be probably passive range of motion that, like, have a physical therapist do to you, or there may be some range of motion exercises that you can do with a pulley. If for example, in the shoulders, where you kind of hold one hand in a pulley and the other hand is pulling that arm up. But other than that, there's not a ton of strengthening exercises that you can do without engaging a tendon.
Thank you. And one more question here we have time for. How do you go about finding a physical therapist? Does a doctor have to give a referral?
Well, that depends on your insurance. So most states now have direct access, so a lot of times you can just call up a physical therapist, because most of us have doctorates now, so you can just call up a physical therapist. Like, for example, you'll call into my clinic, my front desk will verify your insurance or your benefits, or if you don't have benefits, we'll explain costs and all that stuff, and then they'll run you through that information, and then you schedule. The internet is a great tool now if you want to find actual physical therapists. specific one for your needs. So, maybe research psoriatic arthritis specialists if there are any in your area. The APTA definitely has good resources. But a lot of times if you just type physical therapy into your Google search, it'll probably bring up a ton of physical therapy clinics around your area, and then you can kind of just scope them out, check the reviews online, make sure that people are happy with what they experienced. But other than that, of course, you can always feel free to email me, and if you're having trouble finding a physical therapist, and we can try and figure out how to help you.
Great, thank you so much, Brian. We really appreciate you sharing your expertise with us. And if you have any other questions, please contact our Patient Navigation Center by phone, email, live chat, or Skype. And once you leave today's, you will be given a survey on the presentation, and we would appreciate your feedback. And again, thank you to our sponsors, presenting sponsor Novartis, and our national sponsors Celgene, AbbVie, Lilly, and Mallinckrodt. Finally, I'd just like to mention that our recording of tonight's webcast will be available shortly on our website, and you can access our complete webcast archive by visiting psoriasis.org/webcast. Additionally, you can register for our next webinar in our series featuring registered dietitian and certified diabetes educator Paula Valcon. Thank you to everyone for joining us tonight, and I hope you have a lovely evening.